Good evening, and welcome to the National Medical Association's expert-led discussion entitled Emergencies on the Field, Let's Get to the Heart of the Matter this Super Bowl week. I am Dr. Garfield Clooney, President of the National Medical Association and the moderator for today's session. As you know, the world stopped on January 2nd, 2023, when we witnessed the on-the-field collapse and cardiac arrest, essentially sudden cardiac death, of Damar Hamlin, a healthy 24-year-old defensive back for the Buffalo Bills. We also witnessed his miraculous recovery and watched that process unfold over the past several weeks. But just yesterday, February 8th, just 5 weeks after this traumatic event, the world was once again shocked as we heard, and I quote, "I guarantee you that Damar Hamlin will play professional football again." And this was from Dr. Tom Mayer, the medical director for the NFL Players Association. Well, tonight we are here to explore what exactly happened to Damar Hamlin, but beyond that, what has been done to prepare for this kind of incident if it happens on the high school or collegiate playing field. How are we protecting and preventing our children from experiencing sudden cardiac death on the field? The NCAA reports that approximately 8 million students participate in high school athletics. The American Academy of Pediatrics estimates that approximately 2,000 people under the age of 25 die from sudden cardiac arrest in the United States each year, and it is the leading cause of death in young athletes in the United States, resulting in one death in a high school student every 3 days, according to some experts. These are sobering numbers. As the nation's oldest and largest association of Black physicians, the National Medical Association has long advocated for increased exercise and wellness programs for Black children who suffer disproportionately from obesity and have early onset of chronic diseases such as diabetes, hypertension, and others at an early age due to inactivity. Thus, we know participation in sports is good for our overall health. And we also know that participation in sports has a positive impact on mental health. So as the world gets ready for Super Bowl 2023 with the Kansas City Chiefs versus the Philadelphia Eagles, this is a perfect time for the nation's leading physicians to discuss assuring the safety and well-being of our children. Before I introduce our panel, I'd like to thank the Rainbow Push Coalition in conjunction with our 121st President, Dr. Leon McDougall, for bringing this important issue of the safety of our children on the playing field from a health and legal perspective to the forefront. And also thank blackdoctor.org for their partnership in this effort. So our panel tonight is Dr. Christopher Conti, an emergency medicine physician and sports health specialist in sports health and concussion medicine, also United States Soccer Federation team physician and parent of an athlete. We also have Dr. Hakeem Ayinde, a cardiac electrophysiologist practicing in Fredericksburg, Virginia, in private practice, and he's also co-chair for the National Medical Association's cardiology section. Last but certainly not least, we have Reverend Dr. Jeanette Wilson, Esquire, Senior Advisor to Reverend Jesse L. Jackson Sr., and also National Director of Push for Excellence as part of the Rainbow Push Coalition. And I thank you all for joining me this evening. So I'm going to start with you, Dr. Conti. So as a sports medicine physician and a father of an athlete, what is needed on the playing field to protect the health of our children from an equipment standpoint, from a protocol standpoint? What do we need to have?
And I think that's an excellent question, and it's a pleasure to be a part of this conversation. As a parent of an athlete, we have 7 children, and they've all participated in various levels of contact and collision sports. Safety is a big issue. I think some of it has to deal with the fact that we have to acknowledge that with all sports participation at every level, there is some level of risk, whether it be risk of traumatic injury, risk of sudden medical emergency, weather disaster, whatever it is. And so, from the emergency medicine and sports medicine perspective, it really comes down to a matter of preparation, meaning preparation of the athletes, making sure that they have an appropriate level of kind of health awareness and health IQ, preparation of the coaches, making sure that they are aware and have certain levels of core training in certain areas, understanding the response capacity and capabilities of the venues where our young people play, whether it be school or a community event or a large nationally sponsored tournament event or showcase, as well as the capacity of those who are bystanders. And when we saw what happened on Monday Night Football, we saw in a large large public venue, you had really the epitome of response capacity. What you didn't see is that the response capacity for the 60,000 fans in the stadium was equivalent to the response capacity for the players, in that there's a specific contingent of responders that are just focused on the stadium and the spectators. But the difference is when you have that capacity on site and available, and you have trained individuals, and you look at what happened with DeMar, you find that within 10 to 15 seconds of him falling to the ground, there was a responder at the side of the player. He was quickly determined to be unconscious and not breathing, quickly determined to have no pulse and no spontaneous breathing or respiration. CPR was started in under 30 seconds, and the automated electronic defibrillator was on the field and applied to the player in under a minute. And those interventional things on the front end really contributed greatly to the outcome on the back end. So the question really becomes, how can we come close to creating that level of capacity in those venues where our young people are playing, whether it be at school or outside of school. And so I think if we can start having that conversation, that is a step in the right direction.
Great, great. Thank you. Reverend Dr. Wilson, you look like you wanted to jump in there. Do you have any comments?
No, I wasn't trying to jump in. I was just nodding my head. I think that that's the real issue. You have the capacity in professional sports. You have the team doctors, you have the paramedics, you have everything on the field or on the court at the time of play. They're available, trained, and ready. You don't have that in high school, and certainly you don't have it in AU sports. And
Okay,
so the question is, where does the liability go? And I guess we're going to talk
sure.
about that.
We'll get to that. Right, exactly. Dr. Andy, let's bring it back a little bit to what happened to Mr. Hamlin. Tell us what exactly did happen.
Thank you for the question, Dr. Clooney. So Dr. Conti has very well introduced how it all happened and the medical response. So when sudden cardiac death happens, especially in athletes, a lot of times we have more questions than answers. And in this case, as observers, suddenly as someone who doesn't have access to his medical records, there's still many questions that have been left unanswered. When sudden cardiac arrest happens, most of the time, the heart is structurally normal. So when it happens, the most common, if you look at, first of all, the risk factors for sudden cardiac arrest, say in athletes, African Americans are more likely to die of sudden cardiac arrest than other ethnicities. And definitely, if you look at personal history, family history, and if you have a personal history of cardiac disease. Now, I do not know what his personal history is. As a professional athlete, I'm sure he's been very well screened. But again, we know that 25% of people that suffer sudden cardiac death in collegiate sports have structurally normal hearts. And the most common cause of death in these cases are usually arrhythmias, like conditions such as CPVT, long QT syndrome, Brugada syndrome,
Sure.
or what's been mostly said in the media what about Damar Hamlin, which again I will call a diagnosis of exclusion,
Right.
which is a commotio cordis.
Right. And what
So
exactly is that?
yeah, specifically in commotio cordis, it's kind of like it's so rare. It's like a freak accident. So if you think about uh, the heart beats and it relaxes. So every cycle it'll beat, it'll relax. So if you look at it electrically, let's look at a boxer. So when you throw a punch, you connect or you don't connect and you recoil. If you say when is the boxer most at risk, it's really when you're drawing the punch back in, right? That's when you're open and you can be hit. So that's kind of the same thing with the heart. When the heart beats and then it relaxes. So as the heart is relaxing, we call it the repolarization period. So that period is there's a very narrow time interval there when the heart is at risk. That if you have if you get hit at that millisecond time interval, then you can go into ventricular fibrillation, and that is so it's very specific in time. And we will only say it is a diagnosis when we've ruled out every other thing. You've had MRI, you've had genetic testing, you've even with that most of the time we still cannot tell why. Yeah, so I don't have access to his medical records, but
Sure.
I can say at this time commotio cordis, let's just say it's a diagnosis of exclusion.
Sure, sure, sure. So when we're looking at folks that are younger folks that are going now to become athletes, to join teams in high school and teams in college, what should we be thinking about from a preventative standpoint or from a preparation standpoint for those individuals who want to participate in sports? What kind of prerequisite should be required in terms of their health screening? Dr. Conte, do you want to weigh in on that?
And that is a really, really good question, because many people who might be on this broadcast listening in have children, and the typical scenario, and I will say I'm guilty of it too as a parent of an athlete. Let's just say it's a fall sport, which means they start their practices in August, which means you get an email probably in June reminding you that it's time to get ready for August. And the biggest thing is that you have to get your sports packet in. And the sports packet includes a health history, list of medications, previous medical conditions, and then the one-page physical exam. So you call the doctor says, I can't get you in. So now you're stuck because your child is like, look, I can't practice without this physical. So then you go to the urgent care or the pharmacy or to the Minute Clinic, and the person checks your height, your weight, your blood pressure, your vision, and signs your form. So essentially you have not had a pre-participant, what we in sports medicine and what cardiologists and electrophysiologists would call a comprehensive pre-participation physical exam. And when Dr. Allende mentioned that Damar Hamlin had an extensive exam, he probably had several. He had one that he needed that's required for the NFL. He had one that's required by the franchise who insures him as an athlete. He had another probably from his personal insurance company that his agent arranged for him. And if there were any risk factors at all, then he had even more extensive testing. But in general, his baseline comprehensive pre-participation exam included an EKG, perhaps a stress test, perhaps an echocardiogram, which is an ultrasound of the heart, blood work, and on and on and on. Compare that to the child who now is in a pinch and needs to get ready for football practice and goes to the Minute Clinic. And this is not to diminish the capacity or the skill level of the provider in those clinics, simply to say that there's a comprehensive exam and there's not. And so one of the first things that has to happen is we have to raise the level of health awareness as it relates to the importance of the pre-participation physical, specifically looking for little clues. For example, we don't just chalk up high blood pressure in the 15-year-old to saying, oh, they're nervous. We have to look, well, a 15-year-old should not have hypertension. But if a 15-year-old is an offensive lineman and they're 6 feet tall at 15 and 310 pounds, they have hypertension because they're obese. And we need to address that, because that's the child. Because again, he may look like a man, but he's 15 years old and he's 300 pounds. And now we've found objectively that he has hypertension. So we have to take the pre-participation physical very seriously. In fact, in Pennsylvania, for example, on our form, there are lots of places where we sign releases, but we don't acknowledge the risk. The parents sign a release for concussion, they sign a release for heat illness, and they sign a release for sudden cardiac death. But underneath the sudden cardiac death release signature, there's a whole paragraph that says it is highly recommended that elite level or high performance level athletes have a pre-participation physical that includes an electrocardiogram. I don't know how many parents even read that, and you're not going to get an electrocardiogram at the Minute Clinic. So that's the first step. The second step is making sure that the athletes have some level of self-awareness and are empowered to say, hey, coach, I'm not feeling well. The culture in the United States for our athletes is such that there's fear in the minds of these athletes to not want to disclose when they are feeling sick or just feeling off. And some of the hidden signs and symptoms of potentially catastrophic things are subtle, like I just feel a little lightheaded, but I'm not going to tell anybody about that. I just feel a little dizzy. I feel a little fluttering in my chest. My fingers and toes are numb and tingly. These are not normal symptoms, but we've created a culture in youth sports in many places where children are not they don't feel comfortable disclosing to anyone. And that leads to catastrophic things as well. So I think even before they get to high school, we can begin to encourage these things, because a lot of those behaviors begin before they get to high school. When they're playing Pop Warner football or U10 under 10 AAU basketball, they're already being told, hey, just put some ice on that thing and get ready for the next game. Right. An 8-year-old athlete should not have to ice their knees in order to play basketball. The fact that they have ice on their knees because they're having severe knee pain after a basketball game is a red flag that says that child probably needs to have modified activity. But we create a culture that makes it difficult for the older athlete, the high school athlete, to even disclose when they don't feel well. Right. So I think those two things are really important, with the most important being we've got to take the pre-participation physical seriously, especially now in the post-COVID space, because we know, particularly in males, that there is some correlation between COVID and irregular heart rhythms, as well as other structural issues with the heart. And so now we should be asking in the pre-participation physical, have you been diagnosed with COVID in the last 12 months? If so, how were your symptoms mild, moderate, or severe? And then, for me, if I have a student that had COVID and had moderate or severe symptoms, they don't get cleared until they see a cardiologist. Because we've seen, even recently, we saw an NCAA basketball player, not this year, but last year, collapse the first week of the season. I think he was at University of Florida. We saw a referee in the NCAA basketball tournament collapse. Right. So, so again, we have to be a lot more discerning and when it comes to screening our athletes.
Right. And you bring up a good point, in terms of the pre-participation physical. But what my concern is if we require an EKG, that costs, right? Yeah. And so, Dr. Ande, I'm gonna put you in the hot seat from the cardiology standpoint. So what are our options?
So we have two recommendations we go by. The American Heart Association recommends the complete history and physical exam for pre-participation screening. The European Society of Cardiology recommend, in addition, an EKG. And I think here's the caveat. An EKG will probably miss um, these findings in 90% of cases.
This
Sometimes
particular finding from Damar Hamlin.
most people, well, let me put it this way, most people that die, that end up having sudden cardiac
Yeah. Mm-hmm.
arrests, will have a normal EKG.
Mm-hmm.
Yep.
So just having an EKG is not enough to say you're cleared.
Mm-hmm.
What's most important, as Dr. Conti was alluding to, is actually the history, your personal history. Have you had fluttering in your heart? Have you passed out before unexplained? Have you had seizures? Sometimes passing out in children are labeled seizures. Have you had, do you get dizzy spells? Do you have chest pain? When you, especially symptoms associated or right after exercise, family history is also critical. Um, Anyone, your parents, your grandparents, siblings, anyone passed out before, anyone died young, anyone has a defibrillator, has a pacemaker, has some form of heart disease, because a lot of these conditions are actually inherited. Um, the other thing is personal history. COVID is coming into it now. COVID myocarditis is a big one. And COVID has increased the risk of arrhythmias in general and other structural heart diseases.
Mm-hmm.
And finally, when we suspect, so from the AHA standpoint, the American Heart, what they recommend is if you find the reason to
Abnormality.
suspect any of these things, proceed with an EKG, knowing that with every test there are false positives and false negatives. For example, especially African Americans have there's a high prevalence of this early repolarization on the EKG. Most of the time it's normal, although there is a malignant form of it. So, those are nuances that we really need to get an expert to explain.
Right.
And the other thing I'll say is, with this pre-participation screening in kids, we need to understand that. I'll give you an example. Hypertrophic cardiomyopathy, that's one of the causes of sudden cardiac death.
Mm-hmm.
It's really when kids reach puberty that the heart starts to change, and we're able to diagnose this condition.
Mm-hmm.
So if you have a kid come play sports, screen at 10, they're probably going to be normal.
Mm-hmm.
And then the heart changes, then you can find them diagnosed at the age of 14 or 16. So this is, so a lot of these conditions, because these kids are growing and their bodies are changing, unlike adults where you're grown, this is what it is. So in kids, I think there's a role for continued screening. It's not a one-time thing, and that's the biggest thing I'll say with high school and college sports.
And Dr. Yende, you made an excellent point about the EKG. The other part to that is that the EKG is only as good as the interpreter.
Mm-hmm.
And so, you could throw an EKG machine in an athletic trainer's office and everybody gets an EKG. Like, it's Oprah. You get an EKG and you get an EKG. But if no one is there to read them,
Right.
And in the case of adolescents and sub-adolescents, there are many adult cardiologists that would not feel comfortable necessarily reading pediatric EKGs. So you need to have someone who's interpreting those EKGs. But more importantly, it's the health history. It's all of the history. I've had an occasion where super healthy young person, normal, health history, because a lot of times, especially in high school, these kids fill this stuff out themselves. They don't confer with mom or dad. Mom can't, it's my, I got this. Right. And this young man, healthy, everything, no red flags on the physical, no red flags on the health history that he wrote down. And I go into the room and he's got a zipper scar in the middle of his chest. And I'm like, what's that? He's like, oh, that's from when I was a baby. And I'm like, well, what do you mean when I was a baby? Well, my mom said that something was wrong with like one of my valves. And I'm like, well, wait, but his health history was normal. So if I didn't physically, and I say that because some of these pre-participation physicals in quotes that are happening, the day before practice starts, I got to get it done. They do not even disrobe the person. And so you're lucky sometimes if you get a stethoscope on your chest at all. But had I not had him with a shirt off, I would have never known that he had heart surgery as an infant, which is a red flag. I still was able to clear him and get clarification from mom, but that changed the entire dynamic of his pre-participation physical because he had a heart surgery history. The other part is these physical exams, when they're comprehensive, just as we learned in medical school, all of us, you glean a lot of important information just from the interaction with your patient. And so, especially with adolescents and now preteens, we know that up to 70% of them are vaping. High dose nicotine and its impact on the heart, for example, we know many of them because the health risks associated with marijuana have been de-emphasized, are smoking weed. Many of them are smoking cigarettes or chewing tobacco. All of these chemicals are cardiotoxic in higher doses or in chronic use. And then we've got a lot of young people who have been diagnosed with ADHD who are on Adderall and Concerta, which are stimulants.
Yeah.
When you get to the college level, you need to have what's called a therapeutic use exemption to use them. But in high school, there's really no regulatory thing at all. And many of these kids are self-medicating. I've asked kids, I'm like, you use your Adderall in the morning. How does it help with your focus? They're like, it's great. But most sports now are in the evening. So like if you're a football player, you're going to school, you take your Adderall, but now you've got a night game with the kickoff at 7:30 and your Adderall from the morning is worn off. So what do? You want to increase your focus. So you take 2 Adderall before kickoff. So now you're under the influence of basically amphetamine while you're playing football. So you would have a completely normal, structurally normal heart, have no health history at all. But the reason why you suddenly collapsed on the field was because you were self-medicating with your ADHD medicine. And again, we're never going to get to all of the risk and things are still going to happen. But I just emphasize it to just say, because I know just with the soccer team that I coach at the high school level, I've seen the kids come to me. They know I'm a doctor, and they come to me the day of official tryout with form in hand, just saying, "Can't you just sign my form?" And I'm like, "Well, no, I can't just sign your form." And they don't, you know what I mean? So there's obviously a middle ground between no exam at all and the level of exam that a Damar Hamlin gets. But we got to find some place in the middle where we can at least safely clear athletes, because when you look at the clearance form, usually there are several check boxes. One says clearance without restriction, one says clearance with certain recommendations, one says clearance for certain sports only, and one says not cleared at all.
And on that, but on that same token, with that form, Dr. Andy, and I'm going to get to you, Reverend Dr. Wilson, as well. I want to know, should we be advocating for a different type of form? Because you just brought up that family history, all these other things, all these other questions matter that don't seem to be part of that form. And then if a child has a complication while on the field, where does the liability come in? Because we didn't know, we didn't ask, and so on. So should we be advocating for strengthening the information on that form? And Dr. Wilson, Reverend Dr. Wilson, I want you to weigh in on what would be the liability for a school for not having really important information like that.
So I'll quickly chip in here. I think our goal is all of us, stakeholders, parents, teachers, doctors, fans, is to prevent sudden cardiac death amongst our student athletes. 400,000 sudden cardiac deaths happen every year in the United States, and a lot of these deaths are preventable. So before we some things to get clear here: exercise and sports is good for the heart.
Sure. Right.
It's
That's
the
clear.
benefits outweigh the risks
Right.
in most cases.
Right.
However, some people just happen to have a physiology inherited or developed that put them at a higher risk of dying suddenly when they're exposed to the extreme physiology, the extreme exertion that sports, puts on the body.
Right.
And
Because every life is valuable, right?
yes, and these
So-
are the people we want to identify.
Right.
So, in identifying them, we need we're not looking at a form. We're not looking for a signature. We're looking for people. I think everybody, from the provider, the healthcare provider that fills out a form, to the school that hosts the students, that I think everybody has to work towards making sure that, if we have a form that's been signed and this we say that this student has undergone pre-participation screening, that we know that they have undergone a comprehensive history, comprehensive physical exam, and if needed, further testing. And we can say that, we think that to the best of our ability, we can attest that this student is should be safe to participate in sports.
Right, right. So, Reverend Dr. Wilson, so does the school now have an obligation from a liability standpoint to make sure that those forms aren't signed by your neighbor, after dinner the night before, 6 a.m. before you go to school? How do we manage that?
Well, you got several issues. One, the school has liability, and in order to protect itself, the school must make sure that that form is executed by a licensed physician. And I would not, as a school, allow a child to play based on just anybody signing a form. And because if I'm the lawyer for the family, I'm suing deep pockets. I'm going to sue the school system. I'm going to sue the doctor
Right,
who said that this child should play. And it's just a chain. You just go down the chain.
right.
And
So
so
would the solution maybe be the schools themselves taking on that responsibility to do the examinations?
I wouldn't do the examination because unless you have a medical
Yes, a licensed practitioner affiliated with the school.
with the school, that's one. I don't know if they can afford that. And then you have to have the trained personnel on the fields of play. And the question is, if you have multiple sports happening at the same time, how many people do you have trained to handle those sports? Because at the end of the day, and then who has insurance coverage for these athletes?
Mhm. So,
Parents should not sign waivers. I would advise parents to stop doing that,
mhm,
waiving liability for your child when you know for a fact it may be based on family history, but also I looked at when I was listening to you all talk about these two waivers. As a mother who's a lawyer, I would not sign that waiver of liability. I
mhm,
just wouldn't, because that means you have to cover your child for any injuries that may occur during the course of play. That liability should be shared by the school. And the average parent, they look for these children to get them out of poverty if they succeed in athletics, particularly in football, basketball,
there's a motivator there, right?
and
That's
Olympic sports. So they're just like, yeah, my child is going to be an NBA All-Star. They're not thinking about
Right.
that child may not live past high school. So
Right.
we
that's a
got to,
whole other forum, Dr. Clooney, the
Yeah,
commoditization of the black athlete.
right.
But
Yeah,
oh my
yeah.
goodness.
That's
Well, I can tell you in Pennsylvania, the form is 8 pages long. right? And that sounds great. But then if you look at the bottom of the physical form, the individuals who can certify clearance include MD, DO, physician assistant, certified registered nurse practitioner, and school nurse.
Oh no.
And I mean,
Oh,
again,
no.
not to, I'm not diminishing the credentials of anyone,
I'm not even.
but there's a lot of variability in that
Yeah.
in those credentials. And you know, if you're going to the urgent care, in most urgent cares now, because most urgent cares now are staffed by non-physicians because they can't afford to pay the physicians what they want to work there. So and again, it's I don't want to sound anti non-physician, but again, there's so much variability that you get. And again, it's a screening exam. The screening is intended, when we screen, to try to identify people at higher risk based on really just as much data as we can collect. And you would be surprised at the amount of information we collect just by having a moment to sit and talk with the student while we're doing the physical. You know, and it's just, but I've also seen school districts where the packet, quote unquote, is one page and it's just a physical, and there's no health history. And so it's so variable, both internally within a school and between schools.
Right. Should we be advocating for universal forms across the country?
Universal forms, and I think that's something the NMA should recommend, what the form should look like and who should be authorized to sign the form. You cannot have these non-medical people making decisions about the life of our children.
Well, I think it's important. I think what's coming out this evening, what's important is that the parents need to really understand that the physical, the concept of getting a physical done and a history done is really important for the health of your child and how they may fare on the field in certain conditions. So I
think this is the information that most parents do not have, because what happened in high school as high school coaches, and I'm not diminishing them, they are trained to teach you how to play the sport, and do it well
in games,
the game. They're not trained to determine whether or not what liabilities you may have physically as you perform that sport. And I think that without this form being filled out, and we have to have a policy that is for high school and for collegiate sports. These things should happen. The NMA can give us a medical checklist, and then the National Bar and lawyers can say, in order to make sure that you have adequate coverage. For example, Hamlin just happened to have hit an international space, but he would, under normal conditions, did not have complete coverage by the NFL, except that the way his incident happened, his cardiac incident happened, the whole world was watching. So the NFL is not going to not take care of him.
Cover him, right.
Cover him. Had he been a rookie player that had not made it 2 years, under other conditions like many of these players, the coverage would be very different.
Well, this also makes me think about, are there any disparities in terms of, maybe in rural areas, the availability of equipment and expertise is, rural and underserved areas versus urban areas. As Dr. Kanji talked about at the stadium, there are 1,000 people there waiting to take care of folks. Not everybody has that luxury.
Well, and you mentioned that, it's amazing that there's still 17 states in the United States where CPR and automated external defibrillator, or AED, training are not requirements for coaches at the middle and high school level. Wow. Even though we have an 8-page form in Pennsylvania, is one of the states where it's not required. Now, that doesn't mean that individual school districts don't have their own policies that supersede, but the fact that there's still 17 states where you don't have to have training. In Pennsylvania, we're required annually to have training in heat illness, and concussion.
Right.
But no specific requirement for CPR training or AED training.
Right.
And so, so in terms of preparation, that seems to me like that would be a no-brainer requirement. Even if school districts, in order to keep their coaches, had to pay for the training, because I'm sure the coach is going to say, well, who's going to pay for my training? But,
I think,
yeah,
I think, just like parents advocating for their kids with the physical form, they also need to be aware of who is on the field and what's the expertise that's available, and advocate for them in that way as well. And there should be some guidelines around that nationally, though. That's interesting that 17 states, don't require it, and because that really creates a bit of an issue.
Well, I think that we should NMA and perhaps Push Excel and Rainbow Push, and we can perhaps get the NBA to participate. We need to draft a proposal that this legislation be enacted across the country, but also the NCAA should be required to make sure that every high school and collegiate athletic program have certain basic facilities and train people trained. I know for a fact high schools in Chicago, and we're a major urban city, they don't have the resources on the field or on the court to protect players. They just don't.
I'll give you some numbers. So I think the expected survival rate for sudden cardiac arrest, if it happened at a sports facility, is about 40 something percent. There was this study that equipped sports centers, school sports centers with AEDs, and they followed these students and saw what happened. And they realized that in the presence of an AED on site, I mean the automatic external defibrillators, the survival rate for sudden cardiac death increased to 90% amongst student athletes.
That's powerful information. Yeah.
Wow.
Yes. So the presence of automatic defibrillators and trained staff that can administer it, like Dr. Conte was saying before we started the event, time is muscle. The reason Damar Hamlin survived and he had excellent neurologic recovery, like he recovered very well, and he's actually an exception.
Yes.
Yep.
And that tells to prompt response, a witnessed cardiac arrest and timely CPR and defibrillation. That alone is the most likely thing to reduce the risk of sudden cardiac death that's the biggest thing that will reduce the risk of sudden cardiac death among
Right.
And if you were to, just look at schools in general, we were talking offline before the broadcast that for grades kindergarten through grade 12, the leading cause of on-campus death, not in the sports realm death, but on-campus death, is sudden cardiac death. So more than active shooters, more than trauma, more than tornadoes and hurricanes, more than violence, more than COVID, is sudden cardiac death. And that's for every age group, from the time your child starts school in kindergarten until the time they walk across the stage and graduate. Then you add the physiologic demands of sports that Dr. Clooney and Dr. Allende mentioned, and you've got children with underlying predisposing conditions and all the other things we talked about. It makes perfect sense, but I don't know that a lot of parents are aware. And so I think creating that level of awareness is how you trigger the empowered response to say, hey, my property taxes are paying for this district, and I need to know what we're doing. I know what we're doing with Code Adam, and I know we've got security and magnetometers for weapons, and I know all that, but my child is still more likely to sustain a cardiac event. What are we doing to protect these children? Not just our athletes, but the chess team, all
Right.
of them,
Right. Exactly.
and
Exactly.
so and I think that's a really valid, I love the idea of a policy statement coming from an organization of national, international repute like the NMA to say, this is our policy statement for school-based safety. And we believe that these are the things that we should be advocating in our schools, because and I know that in schools with children of poverty and children of color, that whatever is going on right now has not found its way to those schools yet. So
Right.
Nope.
and so we still need to advocate for our folk on the court, on the field, and in the classroom as it relates to keeping the classroom safe. They'll put 5 metal detectors and 2 armed security guards
That's
in
right.
schools of color and poverty, but they won't have not a single AED in the building.
Not one.
Right. Right.
So,
And right. And just shifting gears a little bit. So if your child does suffer a cardiac event on the field, and this is coming at you, Dr. Ayende, so how do we know they're ready to go back out there?
Mm.
Because there's a lot of pressure to win games, to get recognition, and so on. So how do we know they're ready to go back out there?
I had so I once had a patient. He was 29, and he suffered sudden cardiac arrest. And we found that during exercise, we found that he had an anomalous coronary artery origin. What that means was that his the arteries that supply blood flow to the heart muscle itself. So one of the arteries was being compressed, like the artery path, it went under a bridge such that anytime he exercised, that bridge will compress the artery. So essentially, when he exercised, it was receiving, so that area the artery supplies was not receiving enough blood flow. So until the point that he suffered sudden cardiac arrest, luckily he survived. He had surgery, and that artery was reimplanted in a different area. So once he recovered from surgery, got rehab and everything was done, he was cleared, because that's the cause of his sudden cardiac death was fixed. In many cases, they are not. So I think what's important is to identify the cause. For example, with COVID, if you have COVID myocarditis, there's a period of time you stay away from sports before you go back to sports.
Yeah.
If you have hypertrophic cardiomyopathy, which is another condition where your heart's thick, they cannot go back to sports. Arrhythmogenic right ventricular cardiomyopathy, they cannot do sports. So it all depends on the diagnosis. And I think if we have a diagnosis, then there's some conditions where you can fix the problem, like I alluded to, and get them back to sports. There are other conditions where, once you have a diagnosis like the heart is structurally abnormal, you cannot go back to sports. Or there's some genetic conditions like long QT syndrome or catecholaminergic polymorphic ventricular tachycardia, which are just conditions where the electrical system of the heart is unstable. And at some point when you're exposed to exercise, you can go into sudden cardiac arrest. So those people will not be allowed to participate in sports. So so the diagnosis has to be made. Now, one condition where is actually common, but a lot of times we don't have a diagnosis, is primary ventricular fibrillation, where for some reason, this person's electrical system is just likely to go into ventricular fibrillation where the person can die. And we don't have an explanation, and we don't have a solution for it. So, what I would advise is, if you have a diagnosis, there's some conditions where you can fix the problem and they can go back to sports. There's some conditions where, like hypertrophic cardiomyopathy, dilated cardiomyopathy, um, where they cannot go back to sports because that will expose them to another episode of sudden cardiac arrest. And then there's the third one where the cause is unknown. And in those conditions, I will not advise that person to go back to sports, because I cannot tell you objectively that this is your risk. If I can give you a number that, you know what, I know this is your risk if you go back to sports, then we can, do the risk benefit analysis and, have you go back to sports. But if I don't have a diagnosis and it's all conjecture, I will not advise that that person go back to sports.
And for someone like Dr. Conti, with your kids being in sports, how did you navigate the fact that might happen, that they may mask what's going on because they want to be out there, they feel pressured to be out there? How do we help kids in that regard?
And that's a really good question. I mean, part of the bias of being a dad doctor is that the kids didn't always want to disclose because they knew how I was going to respond. So they were often very stoic.
Mm-hmm.
But some of it starts again with that self advocacy,
Mm-hmm.
teaching them at an early age to
Awareness.
speak up,
Mm-hmm.
teaching them, helping them navigate to learn the difference between hurt and injured, and helping, and then advocating to the coach and not being afraid to say, you know what, if you're going to penalize my child for advocating for themselves, then this is not a team that we want to participate in and pay money for, because most of this stuff isn't free. Right. You're paying a good deal of money, and you're not just paying, I would hope that you're not just paying for the little plastic trophy that they get at 9 years old. The reality is like less than 1% of athletes in any level at any sport are going to go on to the next level, which is that professional level, although that's the dream for everyone. The benefits of sports participation outweigh that desire, right? They're learning organizational skills, they're learning accountability, they're learning to communicate, they're learning leadership, they're socializing, they're learning fearlessness and creativity, and all of those things. Those are the true benefits. And if the culture within a sports program is such that it's extinguishing all of those things, then it's not surprising that your child is not going to self-advocate when they're injured or uncomfortable. And as a parent, you need to step in and say, you know what? There are other teams, because guess what? There are dozens of other places where your child can play and participate. Right. And it's especially important because we know that children of color are commoditized. And so the threshold for them returning to the game is lower. Oh, you were just dinged. You didn't have a concussion. You were just this. Oh, don't worry. You just dehydrated. Right. Well, no, an 8-year-old should not be fainting while playing football or basketball or baseball. So that child should not go back until they are cleared by probably several someones. But again, when it's a child of color, oftentimes the thought is, oh, they just need some water and they go back in. So there's the whole bias piece to that as well. So I mean, with our as a parent, you have to be vocal at every level. Right. And make sure and not be afraid to pull your child when you sense that something is not right, because there are studies that have clearly shown in pediatrics that when parent radar goes off, there's generally something wrong. And so, God gave you that radar. And if you are getting intuitive data every time you go drop your child off to practice, mm-hmm. that something's not right, then listen to that little voice inside of you, right. and right. at least gain a level of comfort before you go back. And, right. Those, again, we can't predict, just as Dr. Yende said, there's lots of kids, lots of people for whom we never know why the bad thing happens. Right. But what we're just trying to do is create the safest spaces possible for the kids to have fun and to learn and to go home at the end of the game. And these things that we've talked about today, hopefully will give people some things to think about.
Right. So in the last few minutes we have, I'll give you 30 seconds to say this. So I talked about the medical director saying that Mr. Hamlin is going to go back out there. What do you guys think about that? 30 seconds.
Well,
I know it's complicated, but 30 seconds.
I think if he passes all of the appropriate physiologic, neurologic, electrophysiologic tests, and he signs the waivers, we've seen it in soccer. One of the best soccer players in the world, Christian Eriksen, collapsed and died on the field. Now he's playing with a pacemaker.
Right.
And so it can happen.
Yeah.
So it's possible.
Yeah. Dr. Ande, any other comments?
Yeah, I think I hope that his physicians are making a decision without pressure, and they're making the decision as if this was your son, what would you do? If you practice that way, then in all good conscience, you know that you've made the best decision based on the best
right.
medical data you have.
Right. So interesting. It doesn't sound like you guys are like, yeah, run back out there. He's better. He's healed. Yeah, I know there's a lot to consider. So I think sort of wrapping up, what I hear is that, we may need to look at putting together some joint policy on what's required for a real physical, what's required for training on the field, equipment on the field, those kinds of guidelines, so that there's unanimity across the country and everybody's has the same availability.
Could I just add one more thing that an organization like the NMA and even Rainbow Push could advocate for is the affordability of those resources.
Yes.
Because again, there's been a crazy price hike in the cost of AEDs after this event. And they were already priced out of the realm for a lot of schools, particularly schools in communities of color and poverty. And now they're absolutely priced out. So advocating on a health policy level for the affordability of these resources, including the training, because now the training has gone up in price now. Typically was $60 to $70 per participant. And now I'm hearing like $300 per participant to teach you how to use an AED and do CPR. And those are things that an organization like the NMA could really champion to say, look, we need to make this stuff affordable too.
Yeah. And I think that all of the
last word, Dr. Wilson. Mm-hmm.
All of the school districts should use the health form, the redesigned health form that the NMA will help create. And I would caution parents to have a lawyer review, and maybe that's something we can do in terms of affordability. Review these waivers. That is waiving liability if something happens to their children, and if their children are going to play in sports, they're going to have some insurance. Mm-hmm. And typically they do not. So we need to make sure that these children are insured.
Yeah, great. Well, thank you all very much. My panelists, was very stimulating, interesting conversation. I like the comments that were coming up in the comment section in the chat. That's great. Thank you all, our audience out there in cyberspace. Thank you all for joining us. And please post the link to your social media pages. And the NMA is the collective voice of African American physicians, and the leading force for parity and justice in medicine. And this right here is one thing we definitely have to advocate for. And so thank you again for joining us. Thank you to our panelists. Thank you to the Rainbow Push Coalition, and thank you to blackdoctor.org. Good night.